I'm board certified in behavioral and cognitive psychology, which means in addition to everything I do, I spend a significant amount of time focusing on how people think, how people act, and how we can address those in their deficits and how we can improve them to make their lives better. I moved PTSD out of the anxiety disorders, and it moved OCD out of the anxiety disorders. But they all share one symptom, avoidance.
So if avoidance, which you're describing as an action, is the sine qua non of all forms of anxiety,
Yes.
is the corollary of that worry or distressed thought about the future, absent a behavioral avoidance, doesn't cross the threshold of anxiety and therefore is not necessarily, I don't want to use the word, but pathologic?
Sure. So the DSM at its core is about dysfunction. In every category of disorder in the DSM, from kidney disorders to schizophrenia to medically induced disorders, cancer-induced depression to post-traumatic stress and OCD, if there's no dysfunction in life, and that's usually relationships, occupational functioning, social functioning, educational functioning, if we don't see problematic behaviors in someone's life, then they have worries, then they have sadness. So someone who is sad, who's not feeling great, but they're not acting in ways aligned with depression, it's hard to diagnose them with some version of a depressive disorder. So the short answer is yes. I think if someone is not engaging in behaviors in advance of trying to eliminate the distress, the uncertainty, the concerns about what's up ahead, then I have a hard time diagnosing someone with a disorder.